Well, I think over the past couple of decades, we've learned that even lower is even better when it comes to cholesterol. However, a recent study called Accelerate challenged that concept. We lowered LDL by 37%, raised HDL dramatically, but there was no improvement in clinical outcomes. That's why it's so important for these current trials looking at PCSK9 inhibitors, which will lower LDL dramatically. It's important to look at the outcomes because it's important to understand, is it enough to just get the LDL down, or does it matter how you get the LDL down? That's what we're also anxious to learn. Most of us think these drugs will work, but we're waiting to see the results of these outcome studies. Well, I spent the first 10 years of my career opening arteries and studying how people did when you improved blood flow down the main artery. But I began to stare at this little septic system, the microvasculature that empties all the blood from the heart muscle, and began to realize that we can open the main artery but not open the capillary bed. And what I found was that failure to ultimately restore flow at the tissue level is associated with worse outcomes. Now, we have great treatments in the main artery. We still don't have a lot of good treatments to open up the microvasculature or the capillary network. So I think the hypothesis is correct that better outcomes occur when we open up the capillary bed. But sadly, I think we're still looking for therapies that optimize myocardial perfusion. Well, I think medicine is an art, and I think our patients come to us for more than just science. They come to us for more than just medicines. They also come to us for a lot of healing, and that really comes both verbally and non-verbally. Certainly you don't have to be an artist to be a great doctor, but I do think being a painter, being an artist, certainly helps you begin to develop much more empathy and that connection that patients want at that level of the unspoken kind of word. And I think that's why it's at least important to me.